Welcome back to the Crooked Spine Show. This is one of my recent workshops back in July 2023, helping people understand how to recover from shoulder pain, especially chronic shoulder pain. We talked about in this workshop the outline, how we talked about what the cause of the shoulder pain might be from trauma, posture, and or post-surgical, along with what is acute versus chronic shoulder pain. Also understanding too, what is the actual, how do we assess the shoulder through motion, through strength? And we talked about different stretches for the shoulder and also about strength exercises too. The strength ones being three shoulder exercises, shrugs, and wall push-ups, along the broomstick stretch also. So this talk has a great way to recover from shoulder pain. We also have links to our previous podcast as a YouTube video and as a podcast app. Enjoy the talk, my friends, and get your shoulders and body healthy. Have a great day. 3. Shoulder pain relief, people. I know it's hot out there. Keep our heads straight for 1, 2. With shoulder pain, if we worry about, like I said before earlier, I tore my shoulder before. That's why one thing that I focus on my patients is I can empathize with what's going on. We've all had some type of problem before too. Can dance sometimes too if we can't dance. A lot of it is, can we make sure our bodies are staying healthy? So if it's caused from a shoulder trauma, posture, or even a chronic post-surgical issue too, it takes time to recover your shoulder. The problem with the shoulder, you don't relax your shoulder. Our shoulder's always been working. Unless we're lying down flat with our bodies, our hands across your body, or something like this where that's the end, you're done. At that point, our body is normally have the shoulder to hold itself up. It's always active, so it's hard to recover. So when it does recover sometimes, especially if it's traumatic injury, it'll recover like this. It'll recover like this, not this way. So you have to make sure if we have an injury or a trauma, even post-surgical, we want to make sure we can open our shoulder up, have good position, good posture over time, and as we go through rehab, say post-surgical, our body relearns this position, not where we feel comfortable. That's the plan. Because once our shoulder rolls forward, what happens to our shoulder? What happens to our posture? Our posture also rolls forward too. We've got to keep our body back here, so if we're having a shoulder injury, it doesn't want to become a frozen shoulder here, tight, clicky, unable to lift your arm, versus loose and relaxed, able to lift your arm overhead. All right, any questions so far? Boom, good?
You have to keep them back.
And good, position. So, sitting position, posture-wise. We want our shoulders back where that shoulder is in line with your ear anatomically. When our shoulders are back, our ear lines up with the seam of our middle of our shoulder. If you have a shirt with a seam on, that went all the way down there, so we roll our shoulders back into that position. We have that position, then our body can stay straight up and down, sitting or standing. The problem is the weight of our head, our skull, is not even. Our skull, most of the weight is where? In the back or the front of the skull. What's where more of the weight? Where's the weight more?
In the front.
In the front. In the front. Our teeth and facial bones. More of the weight right here. So it pulls over. If we're sitting and we're relaxed, we're here. You have to be constant. Okay, I want my body back here. Once you stay here long enough, it becomes no position. Posture. What happens when our head goes forward? Our shoulders roll forward also. Got to keep everything back, rolled backwards over time versus being rolled forward. So, standing up against the wall, for example, here, on this one, standing against the wall, as I test my patients too, I want them to feel their heels, hips, shoulder, and head against the wall so you know where their whole body should line up. So that helps them figure out where the shoulders should be. I had someone come yesterday, bad scoliosis, bad shoulder injury. They stood like this. This is their normal posture. So when they went against the wall, they did this. When against the wall, trying to correct their posture, like, it doesn't feel good. This feels weird. Because if their normal is here. They're stuck here. So get them to go to a better standard normal. It feels uncomfortable, weird. Good. Let's make their body here so that pain goes away in the shoulder and the body feels loose and then strong. Questions about that?
Who's going to remind you?
That's my job. I call them every day. I send it when I do my patients. I send them videos, how to stretch, how to strengthen. When I see them, hey, how's that thing going? And again, good question. Who reminds them? It's doing it routinely, consistently, no matter how you're doing. That point, within 3 weeks, 4 weeks, becomes your habit. So you realize this is normal for you now. This feels weird over time. Make sense? If you do something long enough, 3 or 4 weeks, our brain will reset where we want our body to be. My job as a chiropractor is move your bones so your body can reset and give you guidance, make the ligaments and muscles stretch to get there over time. And you maintain it. If you want to, I'll call you every day if you want. Give everybody my number, no one calls me. Yes?
My neck cracks.
Hmm?
That's supposed to feel that?
No. There's pressure somewhere. That's what chiropractors do. But if it
Well, see, I
releases...
had a shoulder for a long time. I carried it. And I got a really good old puncture from bones.
When that's what happens is the shoulder, what does the shoulder connect to? The neck. At that point, it affects everything. That muscle, the upper trap muscle, attaches at the base of the skull, AC joint, point of the shoulder, and somewhere back here through T3, T4. At that point, that triangle muscle, the upper traps, makes everything tighten up that it connects to. So it can cause a neck problem from a shoulder problem or vice versa. Huh? That's what we do. Okay. Is a pain acute or chronic? What does that mean? Acute is, I fell yesterday, hit my shoulder, it's swollen, it's tender, it's hard to move. Okay? I go, let's see if we can calm that thing down. How do we calm down acute shoulder pain? Ice. A little bit of stretching, but ice is better than heat. If something's swollen, it's inflamed, correct? Is inflamed by definition heat or is it cold? Inflammation. Heat.
Ice. We have to use ice.
We use ice to calm down inflammation,
Yeah.
but inflammation swelling is already heat, is already swollen, is already warm blood in the area. So we want to calm it down, push that blood out. That will get new blood in the area to help it heal faster. That's the problem. We need new fluid because new blood has what? Minerals and vitamins help tissue heal faster. It needs those mineral vitamins to help the tissue heal faster. So if we can get that inflammation down fast enough, at that point it won't cause a frozen shoulder. It won't cause a chronic problem. Problem is you call your doctor and go, I fell my shoulder, what can I get in? I'll see you in 3 weeks.
3 weeks, 2 months.
2 months. I'm being optimistic. 3 weeks maybe.
I went yesterday and he said, well, what's wrong? I go, well, after 2 months I can't remember what the problem was, but I'll tell you what, I said, how are you feeling? Great today.
I feel good. You cured me,
I go,
doctor.
but let me give you a list of all my things.
I had someone call today, they said about 3 to 4 weeks minimum for a bad injury. So then what they do, well, if it's that bad, they tell you to go where?
Emergency.
Emergency.
Stay there for hours and hours.
Urgent care.
People die there.
It's almost a past accountability to somebody else versus doing their job. That's what I think. What do I do? I see 80 people a day. Obviously, I'll see if you need to come in, I'll see you tomorrow. Latest tomorrow. You know, it's having that, what I talk to students about, it's that ability to show that you care about your patients.
My doctor cares, but it's only 15 minutes at the most, so I just take a list and he checks what he's
When you're on the clock, that doesn't mean that is it genuine. You know what I mean? Like, okay, you have 15 minutes, go. No.
Well, what can they do? I mean, this is Kaiser. I mean, they're...
This is the insurance company telling the doctor what to do versus the doctor
That's
being
right.
taking care of their patients. So hey,
It's not the doctor's fault, though.
it isn't, but I wouldn't work for a system like that. It's like in the chiropractic. Not only can I golf once a week, I can also take care of my patients. I want to take care of my patients. I want to spend half an hour with them, good. Spend an hour with them, good. But it depends what they need. How do I know every patient can only take 15 minutes? I don't know that. No one knows that. But we want to make sure we take care of our people no matter what so that we can avoid a chronic shoulder problem versus taking care of when it's still acute. But if someone comes in and they go, for example, I'll see you in 3 weeks or 2 months, at that point by then, yeah, the pain may go away, but now they're stuck. Now they can't move. Now it's frozen, where all ligaments, muscle down made this is normal, and affecting their neck and upper back too. And they're grouchy, they're tired. Time to move, it hurts. Yeah, well, you have other problems. That's not right there. That's something.
Well, I had my bones got well, I guess.
Huh?
Big bones sticking out here. I don't like that.
It got well, but it wasn't fixed. That's the issue. And again, right now at this point, okay, how do we increase range of motion, cause more motion, give you more flexibility and more strength? But 100%, that's fine. When I tore my shoulder, I still have a gap right here because the muscle is never reattached. But I can still lift weights, do everything I want to do. It just got to make sure I do my stretching too.
Yeah, that's good. I agree, I am the bones are just.
So the goal is now, how do we continue stretching to make sure that maintains your range of motion, doesn't get worse, and then strengthen when you can. It just works. All it is work. When during COVID, I think I told you guys 20 times already, I had 2 weights at home. During COVID, because all the gyms were closed, right? The YMCA was closed. It was all closed down. I had my wife's 5-pound pink weights. That's all I had. That's not enough for me. I could do like, okay, 80 of them, 90, 20.
Yeah.
So at that point, because I didn't have enough stress on my body to exercise, my shoulder got tighter and tighter and tighter. Once the YMCA opened up again, first 3 weeks I'm like, this feels so not so good. This hurts. I had to get through that so-called tearing to make my shoulder better. But knowing what to do and when to do it is the key. Green light to when to stretch, when it's not painful, but also when it's chronic, then you have to stretch, even through the pain. All right, so we'll go through stretches too. That's the easy part for 1, 2. Shoulder assessment, motion. Okay, what is the normal position of the shoulder? Is it this? I just said so no, it's not. It's open, but also enough range of motion of the shoulder where your hand stays here or here, not here. That makes sense? If my hand's turned in toward my body, and I'm also if you're in front of me, you're looking at the back of my hand. At that point, that means my shoulder, all my muscles in my arm and shoulder are turned in. Oh, secret. Don't tell anyone, secret. Okay? This is how I know someone has a shoulder problem or bad posture, or not the bad posture, poor posture, because the shoulders are like this. So, yeah, you thought until I told you different. I know what I'm doing. I have 2 letters after my big student loan to pay off eventually when I die. Okay? So we want to have our hands open here, ideally, versus here. You may not even feel pain here. The problem is once you lift your arm up, it hurts. Lift your arm up here, it hurts. You bring your arm out here, it hurts. So range of motion, shoulder, you want to be able to get that hand, because it's connected to the shoulder, that hand will be your guide to get 180 degrees all the way up. Much as we can, that's the ideal. Okay, again, perfect. We want to test the other side too. Are both sides even? When you bring one up, it might be okay. Because your shoulder are connected back here and back here. When you bring the other one up, it may actually limit your range of motion, so you feel like you're stuck here. One might be okay. The second one comes up, then you kind of limit your motion to the other one. So watch how it goes. So here, bring my right hand up, left arm comes up. Feels pretty good. I bring my arms down, bring my left arm up, right arm up to the left side. It's tight. It goes a little bit tighter than normal. We're all going to be off a little bit. Not going to be evenly all the time. My wife says I'm off up here a lot, but that's a normal thing. All right. So we want to make sure we test. Arm comes up, good. One arm, other arm comes up, good. Feels evenly good. Then bring them both down. Switch hands. First arm comes up, other arm comes up, other arm comes up too. That point feels good. Okay, we're okay. Okay, now what we want to do is bring your left arm, start your sides again, now your rest position. Left arm up to your side. Okay, how does that feel? Does that feel okay? Now from there, just parallel to your body, just parallel. Now from there, bring it up over your head with your palm facing out. So just like that, palm facing out the whole time. How to bring your arm, your upper arm, to your ear without bending your ear. Don't cheat. Don't cheat in. All right? So that's minimal. We want to make sure over time now we have something to work with. Okay? Now switch sides, same thing. Bring your right hand up, just parallel to your body, just parallel. Palm facing down. Now bring your bring your upper arm up to your ear again without bending your ear, up to your side, let your palm face out away from you. Okay, that should be ideal. That's where you want your arm to go. If these are limited, that means your shoulder muscles are tight. We can figure out which one it is in a second. All right? Any questions yet?
I do lifting in the water, and it's fine, but when we're doing, because
weights.
this is the first time that I do it in the water going up, I haven't done it with my regular weights at home. I get tired.
It's part you gotta get stronger. You have to yes.
At least, a minute and then I can continue, but I get tired.
It's okay. It's tired equals strength. You're making your shoulder strong. You got a question too? You're raising your hand.
No.
Sure? You're raising your hand for something.
Just checking me out.
Just checking. All right. So we want to make sure we're doing enough to do that. Who wants to be my volunteer for the strength exercise, strength assessment? Somebody come over.
I don't know what we're going to do. You're not going to be looking at my shoes and
not today. I already saw them. I saw your shoes. It's too late.
I still nag about it.
Grab a seat. So now what we're going to do is test your shoulder strength. So bring your hand out here. Hold. Does that feel okay?
That feels okay.
I'm going to push your hand down with my 2 fingers. Try to hold it up. Does that cause any pain in the shoulder?
No.
Good. How about in the neck?
No.
Good. How about the upper back?
No.
Good. Now stay right there for me. Turn your hand over. I'm testing now the strength with the front shoulder. Okay?
With the what?
When I was here,
The front.
I was testing where the middle, your shoulder muscles, your delt muscles of your shoulder, go from the very front, anterior, middle, and back posterior. You have 3 parts of your deltoid muscle. So anterior, middle, was going to be with the palm facing down. Anterior will be with the palm facing up. And hold your hand right there. Don't let me push it down. Hold. Does that cause any pain?
A little discomfort.
A little bit. The front sometimes is real tight. That can happen. Now, bring your hand all the way back, just like that. Real simple. We're going to test the posterior delt muscle, and then hold. How does that one feel? Very common for the back muscles of the shoulder, the posterior delt muscle, to be weaker than the anterior delt. Why do you think that is?
Because we don't use them as much.
We don't do a lot of this. Coming back more. We do more here, more holding here, more lifting here, right? So your muscles don't get worked very much. We have to do certain things, but I'll give you in a few minutes, to make those posterior delt muscles strong.
No, mine goes like bang.
It's crunchy back there. I'm going to work on that one too. And we got work to do. Now, bring your arm up, right here, and then hold that right there for me. Don't let me push it down. Feels okay?
It feels okay.
Good. Same thing, I'm going to turn your hand over, and then here, feels okay?
It feels okay.
Good. And then now here, over here. Feels okay?
It feels okay.
Good, relax. Why do you think it's easier out front than out here? Why do you think that is?
Because we use it more, I suppose.
You're already here all day. You've used these muscles all day with your arms in front of you. Now, all these muscles here, your pec minor muscle, pec major, anterior delt teres minor, have all worked to make that stronger no matter what. So if a shoulder is a problem, especially chronic shoulder problem with no injuries, that means the muscles now have gotten too strong in the front to cause us to hunch forward, so the posterior deltoid muscle is more weak. You got to get it stronger. All right? Good job, Sylvia.
Get a lollipop.
Good lollipop. I'll give you lollipop later. Okay. Now, shoulder stretching. This is my favorite one. I'm doing this on the floor here, but it's meant to be done outside of the bed, or I use a table in my office.
Get down there, you can get up.
That's what I do in bed, though. I remember that from last time. Okay? So if I'm in bed, I'm going to take a water bottle, just to start, can of soup. If you have chicken soup, let me know. I'll come by and pick it up. Okay? It's my favorite. I'm going to take that can of soup or water bottle, side of the bed, and I'm going to put my arm like this, my elbow straight out, lie relaxed, and now I'm going to let my hand with the water bottle facing down to me, let it come up and face up toward the sky. Okay? Some people with a shoulder problem, they can go maybe to here and it hurts. And sometimes I'll even have to start here, then come out slowly this way. But I want them to see is over time, can they get back here where it comes down, feels comfortable, you can come down even further than they can handle. Because our goal again is to unwind all these muscles here to make that looser. So we have to unwind, getting that shoulder back this way. All right? Just to see it too, if I'm sitting up doing it, I want that shoulder, if I'm lying down, that shoulder come back this way as much as I can to get that to come back that way. Make sense? If I have a shoulder problem though, I may have to start here inside, elbow next to my side, then come out this way to start. That feels okay. Then I'm going to come out here slowly, and then out here over time. It depends on where someone is, how tight something is. All right. Anyone want to try this? Nothing yet. I'll have other ones for you to try. This is going to help loosen. If we get a shoulder back, this external rotation behind us allows us that shoulder to get stronger over time and looser at the same time too. Question? Just practicing, I know. Okay, next. The next one is going to be the corner door stretch.
Well, how many times do you need to do that? 5 times?
I would hold it for a full minute just to hold. It's a hold stretch. So you want to do is hold that. You want to hold that wide valve canvas suit backward as much as you can. Just hold it back while you're lying down to let that ligaments want to stretch in your shoulder. Think of your shoulder and your hip as one to unwind that piece of rope. Want to unwind it all the way through. All right. Next one, corner stretch. I'm going to use this corner over here. If you guys can see me. This one. This is going to be allow your shoulders now to go from being here together to more open. Again, if we're closed off here, we're hunching forward, shoulders closed in, for 1, 2, rolled in. Let's unwind everything back here. All right? What I'm going to do, take corner of the wall here. All I'm going to do is put my hands shoulder height. I'll put 1 foot forward. I'm going to lean into the wall, keeping my body up the whole time, head up the whole time, head up. Just like that.
We can't see your feet.
Sure. Let me get over. I'm gonna.
We'll get over. We're just seeing.
You see. So here, I'm gonna put. It doesn't matter which foot it is. 1 foot forward, just for balance. Hands shoulder height. Head up the whole time. Body up the whole time. Just lean in so my shoulders here will open up all the way through. Get those pec minors, anterior delta stretch. So my shoulders come back behind my body. You almost want to feel the relaxed state. That back here in the middle wants to pinch a little bit. And hold that pinch for about 10 seconds. So 10 second stretch, hold, and then relax. 10 second stretch, hold, and then relax.
So which is better, the one on the floor?
Both. The one on the floor will give you individual shoulder stretch. This one will even things out here. Your body burns. What side's tighter? Burns to stay more even. Yeah. So you want to do both. A lot of my patients is I'll give them 2 or 3 to start and work them all. So you know what's going to help them over time build that routine going on. This works. All this work. Okay. Next one. Broomstick stretch. You guys remember this one, correct? The broomstick.
Oh, yeah.
Mm-hmm.
You got a curtain rod.
Yeah, it doesn't matter. Whatever works for you, lead pipe, whatever it is. Whatever crime story you have. A cane works too, as long as it's wide enough. It's always wide enough. So you want to do now modification. Instead of going all the way back to start, it's hard to do, right?
I don't get that.
Hard to do. You want to do modification is we'll keep your elbows straight the whole time. At that point, body up, head up again too. Elbow straight, come back to where you feel uncomfortable.
Oh, right there.
Hold it there for 5 seconds. 5, come back. So I tell people 5 seconds, 5 times. Up, hold, 5 seconds. So over time as you do it, then it'll get easier. It may take you a couple of weeks. I had a guy come in, young guy, 42 years old, 42, had a shoulder problem. Took him 2 weeks to actually finally clear his shoulders to come all the way back.
Oh, God.
Oh, my God. You never do that.
Yeah, every time I did, dislocate my shoulder. Full dislocation. No. This time. Because, again, it's for my shoulder, right?
Yeah.
I do it every day.
Oh.
Every day, so it doesn't tighten up on me. How many times a week? 7 times a week. What days end with Y? Every day.
Sunday.
So even Sabbath, they do Sabbath too, might as well. Come here, try. Come and try. Here. No, come here.
Oh.
Oh, you have to volunteer eventually. You can't always sit in the back of the room. I get points or something. I don't know what I do.
What do you want me to do?
Come over here. I'm going to show
With
you.
this,
Actually, do you have a broomstick at home?
do I have what?
A broomstick?
Oh, yeah.
Yeah, broomstick. I'll use a broomstick at home. Simple things.
I just fell, a couple weeks ago.
Yeah.
So,
So you can do that sitting down if she needs to.
Yeah, if you need to. Let's try it standing first. So I'll put this over here. Here you go. I'll watch you, okay? I'll put my hand on your back right here. Head up. Smile for the camera. And scoot over more, scoot over more. Scoot over this way.
do what?
Scoot this way, slide over. Right there. And now, go straight up. Oh, I can see which one's tight. Is that uncomfortable?
No,
Good, go back further. Is that uncomfortable?
it
A
started.
little bit, good. So here's where you want to start. 1, 2, 3 Mississippi, 4 Mississippi, 5 Mississippi, 5, 6. Okay, come on in. One more time. Where it's uncomfortable, boom. We want to go. And doing this for you twice because the shoulder is frozen. Twice a day. 5 times, 5-second hold. Just works, all this work.
Oh,
All
good.
right?
I'll try it.
What's your name again?
Maybe sitting down, if she's gonna fall, maybe she should do
So
that.
here, try this and see.
Do what now?
Try
Yeah,
doing
I-
sitting too. Try. We'll try. See.
Unless she
Yeah, the
has
reason
some-
I never went with a cane, but now I have a cane because I fell.
You want to make
a couple
sure.
weeks
Do it
ago.
sitting
Want to
down.
be safe. Try sitting down now.
Do I what?
Try to stretch, go as wide as you can. Wide as you can, wide.
Oh, yes, okay.
And
I
now,
can feel it, but it's okay.
and then go back as far as you can. So done the modification, you can do it sitting down.
Yeah, about right there.
Perfect. Instead of standing up. That's safer for you. Feel more balanced. Because if you're unbalanced, you're going to feel like, okay, I'm worried about this, not about this. One more time. All the way up. Smile for the camera, smile. All right, we're good to go. Good. 5 times, 5 seconds.
Okay, yes,
All
I
right.
have a big old lumpy bone sticking out here.
Yeah, it's right over there. I can see that one. That's okay. It just worked. And with your cane, quick question for you. If I brought this cane higher, would that be okay?
Yes, and do anything, but
Good.
I don't like it, but I have to.
Right now. So now when you're using the cane, stay up here, not down
That's
here.
much better.
Let's try that and see.
Look at that.
Up. There we go. There you go. Take a step. And walk with it up there, not down here.
Oh, that's better.
Yeah.
But you know what, I have these shoes on that they have a arch
Yeah, good.
in, and I can feel the difference because I have another cane, and I just found this out yesterday. When I had this shorter cane, it's a little shorter
Yes.
here, this was hurting.
Mhm.
Then when I went to this, it didn't hurt because I had this back up, I think.
And plus, you were more on your middle of your hip, not the front of your hip.
Okay.
Be taller. All right. Good.
Thank you.
Good. You're welcome. Good, Ruth. Good, Ruth. Okay. Now, pre-shoulder exercises. That's a long one. Or maybe take an intermission or something. I'm not sure. Just like popcorn.
Yeah.
So now, how do we get our shoulders stronger? Okay. How do we get this back here stronger, this stronger, because it all connects, right? And also back here, the rhomboid stronger too. So we start doing this more, not here. Okay? I always go when I have that posture.
I was going to ask you a question.
Yes.
I was told that my arms, because I was sore, used to be on.
Yeah.
And then when I took it, all my clothes were clear down here. So she finally measured. She said, you have short arms.
Everyone can be off by about maybe half an inch, sometimes a full inch. Everybody's different. We're all, not all born the same, but we're all perfect, right? We're all perfect. At least I am. All right.
Right.
That's the thing, but the problem is when we're off too much, we gotta go. Is my shoulder too tight on one side, making my arm longer? You know what I mean? Is my body balanced, or is my body's posture causing a longer arm? Because of your shoulder issue, it would actually make your shoulder most likely a little longer on that right side. If someone has a rolled shoulder going forward, right on that longer side would be a little bit longer. Everyone's different though. Sometimes I'll measure people's hips on an x-ray, shoulder a level on the x-ray too, to see if that might be causing an issue. And then adjust the ligaments and muscles, even joints if need be, to make them even more even. Right? So 3 shoulder exercise here. Take 2 water bottles. Not Kansas City, this is water bottles, not Kansas City, just water bottle this time, okay? Pay attention, pay attention. Here, number 1, elbows tucked into your side. Now bring those water bottles, keep your elbows in, straight out. Ugh, painful. Time. Elbows tucked in, elbows, get those water bottles to touch the wall on both sides of your bate. All right, 5 times. Okay. Second one, after you've done this one 5 times, elbows tucked in, hands with the water bottles, thumbs pointing up. At that point, come straight out, hold for a second, and come back in. Number 1. To go with this one, get the shoulder blades back here to also pinch. If I'm pinching here, making these muscles, the posterior delt muscle again on both sides, work, activate, stronger, hold my body back here instead of being All right, number 1, number dos, that means 2. Okay, elbows, shoulder height, thumbs pointing toward each other, toward you. At that point, water bottles parallel to the ground. And then when it's against the wall, head up and bring those water bottles up toward the wall above you. Hold for a second. Now bring that water bottle flat again, horizontal, and up again, hold for a second. Takes time, effort, work, people. Work.
That's more than a second.
Yes. Oh, yeah, forgot. Get distracted. One more time. Hold. And then back down. Woo, take a break. Water break.
This is nothing. I mean, we won't have anything in our hands. Have a little bit
Yeah.
of weight, you're gonna feel.
Because what is a water bottle? What's the weight of a water bottle?
1 pound or,
Maybe a pound times gravity.
Will it be the ounces it has?
It can be any brand.
No. It says 20 fluid ounces. Will that be the weight?
Yeah, that'd be the weight. This is going to be.
so that's a little over.
This is 16.9 fluid ounces. So whatever you want to use, but make sure they're even though. So make sure they're even. That's number 2. Number 3. Whew, you guys ready? Instead of being flat on the wall, now we're going to do feet off the wall. Legs a little bit bent the knees. Stand flat first. Now tilt at your hips, leaning forward. Okay? Water bottles go straight out, thumbs pointing straight out away from you. Arms relaxed. Okay? We're going to make sure this time the goal is to make sure back here you pinch back here, top of your shoulders, back of your neck. What I'm going to do, as I'm standing there, feet off the wall, legs bent, body tilted forward, back straight the whole time, water balls pointing forward. I'm going to come straight up to my sides, reverse fly. Hold as my head stays up at the same time, nothing moves but my hands, then come back down. So again, I'm going to come up. My water ball should be at the level of my head, next to my head. Up, hold, and then back down. Okay, what I'm doing with this one again, getting back here to pinch. So up, hold, and then back. Whew, any questions? Oh, very fun, right? Fun.
Discipline.
It's just, but also let people know, wow, this side, I'm okay, my shoulders are good, but also like, I have no range of motion, I'm only here. I can't go all the way back. If I have less range of motion in my shoulder and try to do weights, for example, I'm going to tear my shoulder like I did. You have to make sure your body's loose overall to prevent injury. That's the plan. Okay? Next one. So any question about the 3 shoulders? So just to review, since I forgot. Body against the wall, number 1 exercise, elbows tucked in. At that point, water balls come straight out, touch the wall, and then relax. 5 of those. Number 2, body against the wall, head against the wall. Elbows parallel to your shoulders, pointing out, winging out a little bit. Water ball is pointing toward you. Come straight up. Water ball touch the wall above your head. Hold for a second, and come back down. Boom, this worked. Last one. Feet off the wall, legs a little bit bent. Tilt at the hips, coming forward. Point water bottles away from you along with your thumbs. Head stays up the whole time. As you bring the water bottles up, pinch the back of your neck. Hold for a second, then come back down. Just worked, always work. All right, let's try the last one. Want to try the last one? Anybody?
Well, I'll try it.
Yeah, come over. This is the last one's a little bit more like,
So
it's
it can
finesse.
be reinforced
Yes.
in the brain.
That's why I do my patients. If they don't let them try it, they're not going to know what's wrong. Here you go, man.
Okay.
Just don't take them home. Get thirsty.
All right, what do you want?
I want you to do
Oh, you
feet
want me
off
to
the
do-
wall.
Okay, feet off the wall.
Tilt at the hips. Now, water bottles at your sides, lift and drop. Head up. You're going to bring the water bottles out this way. And hold. Good. Hold, hold, hold. Pinch, 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 pinch.
Breathe.
Come back down. You got to breathe too. Yeah.
Not breathing.
You're not gonna. Oh, yeah. Relax, 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 relax. Yeah, relax, relax, relax. Good. Position one. Head up, head up, head up, head up, head up. Good, right? Perfect. Smile.
All right.
Good, smile, smile. Good, good. Now put your arms up. And here. There we go. Up there. Hold. 1, 2, 3. Come back down. There you go. Where do you feel that?
I don't know, I feel it right here too.
And then everywhere, the whole thing.
I don't know if I felt it in the back. I don't know. I'll
It's
have
bring
to
it up
try it.
and pinch. And then come back. Thank you again. Appreciate it. I'll give you a nice pack later for your back, okay? Got it. Last one. This is the one where you know, okay, I have strong shoulders now. My shoulders are strong, that means the injury is not gone, but it's almost gone. This is 3 positions of the wall push-up here. First one to start is going to be wide. Okay? Want to stand parallel with the wall, just parallel with the wall. Okay, not lean forward or backwards. Here, what I'm going to have you do is hand shoulder height again. Just let your body lean into the wall, just like that. Okay, once you do that, then you're going to push off the wall with using these muscles right here. These muscles are your anterior delt, and also when you're coming back here too, here, you can also use your posterior delt too to push off the wall. People realize this, once your elbow goes behind your shoulder, using these muscles back here to get to that original position. So you want to make sure if you're going to do a posterior delt workout back here, you want the elbow to go behind the shoulder, hold, and then push off that way. So you want to do number 1, the wall push modification. Here, elbows beyond the shoulders, widen the shoulders. That one, hands also. Come in, hold for a second, and then push off. Okay, number 1, like 5 times. Simple, 5 times. Second one, elbows tucked in. Okay, what you do now is elbows tucked in, about shoulder, more right next to your pelvis, outside of your body, and then come in, hold, then push off. Okay, I want to make sure everything down here is working too. Yes.
I'm afraid to fall down.
Good, so go slow, go slow. If you need to put a seat behind you, back here, to make sure you're not gonna, so here, I would do, so make sure you have good balance, put one behind you right here, come in, hold for a second, come off slowly until you touch the chair. That's sticking in my head, I'm creative. I'm an artist somehow, I don't know what's going on. Okay. Now, that's number 2, right? Here, elbows tucked in, come in, hold, and push all the way off. Number 3 modification. We want to now work the individual muscle of each shoulder. Okay, so what we're going to do, left hand behind your body, right hand on the wall, about shoulder height, here, right, point my shoulder right across here. Do now is come in, hold, and push off just with that hand, but don't let your body turn. Keep your body steady the whole time. You come back the same amount.
Fancy.
It works.
I'd fall down.
It's taking your time to do it though. So for yours, because of balance, I would just do number 1, number 2, then number 3. Okay. So again, elbow behind you, arm behind you, body steady, body parallel to the wall. that point, hand shoulder height, lean in, hold for a second, come back, keep your body parallel the whole time, slow, 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 and push yourself all the way straight. Okay, that might feel okay. Second part, I'm going to do now, the other one too. Does this feel the same? Left hand shoulder height, that point, let your body be parallel to the wall, come in, hold for a second, push up, keep your body parallel the whole time, do not let it turn. Alright? Who wants to try this one?
Is this for the back?
This is for actually the shoulder, the back here, and the back here. All of it.
Yeah.
All of it. The push-up is a great position for your whole upper body. So doing this, once you've graduated from the stretch exercises, the broomstick, the one on the floor, arms coming back for 1, 2, other 1, 2, even the 3 shoulder 1, 2. This is getting it all working together. At that point, so our body can actually start working together, keep it strong. And balanced versus being torqued or dropped for 1, 2. Just worked all it is. So again, last one here, hand behind your body, one arm up, shoulder height, come in, fold, come back, keep your body straight the whole time. Let's work on these muscles back here, even your core muscle of your lower back too. Keep your body straight versus being turned. Alright, it's work. But practice, use your chair if need be, so you'll lose your balance. And no injuries here. Okay, I have no liability insurance. Alright, I already have a license, I got that, cancel that one, too expensive. Any questions? This video will be on YouTube later today, maybe tomorrow morning, to give you a way to kind of reset your shoulders, get things set for yours, for example, too. Number one thing, just lie on the edge of the bed, water bottle, let that shoulder come back.
So many.
It is a lot. It is a lot.
Different ones.
Mm-hmm. So once someone gets to where things feel good, focus on just the stretching. And maybe stretching once a day where you get your body with that broomstick. That's what I do once a day. Morning, 10 all the way through, just like this, all the way back, all the way forward.
That's kind
10
of
times.
fun.
Yeah, it is.
Yeah, that one would be.
Once you get there. But it's every day. When you do them every day, your body will improve. You know, we have to keep working every day. Just work.
You have to remember.
Well, that's why you have the list to remember.
On
Or
YouTube-
videos.
On YouTube, how do you look your,
At the very bottom there, it says my office page on YouTube, Acute Chiropractic, and this playlist will be the actual workshop playlist.
YouTube, okay.
Mhm.
Search Euclid, okay.
And then go right to my playlist called Workshop. It'll be there by tomorrow morning.
All right.
Today I have no idea what's going on this afternoon.
Got a date.
Good. Leave a little thumbs up maybe, I don't know. Whatever you want to do.
All right.
Questions? Sir, questions?
I got a question, but it's not related.
Okay. Okay, I'll stop the video and we'll talk about your lottery number question, whatever it might be. All right, guys, thank you for everything coming in today.